A common reaction to antinatalists is the assumption, either implicit or explicit, that antinatalism could only be arrived at in the setting of a mental health disorder or some sort of past psychological trauma. I disagree with this, of course, and I think it's worth addressing the multiple problems this assumption highlights. First, antinatalism itself is not necessarily indicative of a mental health disorder. Although there is no universally accepted definition of a mental health disorder, and there is considerable amount of subjectivity in the label, there are useful established definitions. For example, the DSM, which is a standard psychiatry reference, defines a mental health disorder as a clinically significant behavioral or psychological syndrome or pattern that is associated with present distress or disability or with a significantly increased risk of suffering death, pain, disability, or an important loss of freedom. It further details that neither deviant behavior, for example, political, religious, or sexual, nor conflicts that are primarily between the individual and society are mental disorders unless the deviance or conflict is a symptom of a dysfunction in the individual. Choosing not to procreate for ethical reasons simply does not fit into that definition. Of course, as in any sufficiently large group of people, there are some antinatalists that suffer mental health disorders, but it is not necessarily because of this that they are antinatalists. Second, although past psychological trauma may make a compassionate person think twice about inflicting suffering on others through procreation, being an antinatalist doesn't automatically mean you had psychological trauma or had an abnormally torturous childhood. Again, believing it is ethical to spare others of suffering is hardly proof of dysfunction. Unconventional doesn't mean dysfunctional. Having said all this, even if antinatalism is more likely to be adopted by people who have experienced trauma in their life, this doesn't negate the veracity of the antinatalism argument itself. Just as Isaac Newton's childhood trauma doesn't invalidate the usefulness of his math and physics discoveries, an antinatalist's troubled past doesn't nullify the validity of his argument for antinatalism, if the argument itself is logical and clear. This topic begs the question, why do we even need to clarify that antinatalism is not a mental health disorder? Why would antinatalism be associated with mental illness in the first place? My guess is that there's probably a complex interplay of cultural stereotypes, reactionary arguments, and subconscious biases against the implications of antinatalism in most societies. It's possible that the idea of antinatalism triggers conflicting feelings in a lot of people. The thinking might go as follows. Preventing suffering is reasonable. That life inevitably leads to suffering is understood, though often ignored. Avoiding procreation is deeply unacceptable, but rationally is the only guaranteed way to prevent suffering. By procreating, one inflicts suffering, which conflicts with the first premise of preventing suffering, which initially sounded reasonable. The clash of these beliefs leads to an uncomfortable scramble to find a psychological defense mechanism against the whole idea of antinatalism. And sometimes the easiest defense mechanism is simply saying the antinatalist himself is sick or defective, so one can discard his argument as crazy without actually dealing with the discomfort the argument creates. After all, it can be quite uncomfortable to face the contradictions in one's deeply held beliefs. So, are antinatalists as a group necessarily depressed or deluded or in deep dysfunctional distress? Of course not. Antinatalists generally value making ethical choices that minimize suffering, and we simply observe the fact that in this universe, the evidence points to suffering being an intrinsic part of sentient life. Procreation carries the responsibility of inflicting this suffering on one's offspring. Therefore, if we are to make ethical choices, we have to consider that avoiding procreation may be the most ethical of those choices. We can still lead well-balanced, productive, compassionate lives. There is no need to be hateful toward existing people, and in particular, there is no need to be hateful toward already existing children, which is another stereotype sometimes attributed to antinatalists. I should mention that though I've been making the case that antinatalists generally are not necessarily mentally ill, this shouldn't be taken as another attempt to stigmatize mental illness. People who suffer a mental illness have enough on their plate already and don't need society to create more suffering for them by degrading them as people. My point is mainly to push back against incorrect assumptions. It is true that some antinatalists suffer from mental illness, and it might even be true that their mental illness makes them more aware of antinatalism's value. But again, antinatalism can stand on its own and can be espoused by healthy, sane people. But this does raise the point that perhaps people who suffer from a mental illness bring with them a valuable perspective to the table. They are keenly aware of certain types of suffering that would be rational to want to prevent from happening in others. And this deserves to be included as part of supporting evidence for antinatalism. As a closing side note, on an earlier episode, I mentioned I would comment on the validity of labels for mental illnesses created by modern medicine. These labels have changed over time, not only in response to new scientific discoveries, but also to changing cultural values. So, with that in mind, here's my perspective on the matter. In my view, the usefulness of diagnosing mental illness is that by identifying a pattern of symptoms, that person's quality of life could be improved if certain treatments are applied that are known to have helped other people with similar symptoms. If the diagnosis does not improve the person's quality of life, either because there are no treatments or because knowing the diagnosis doesn't add anything of value, then one has to question the purpose of sticking a label on the person. Labels, in this case, are only as useful as their effect on improving outcomes, and should not be used to inflict further suffering on those who carry them. Thanks for listening.